It's your first day working as a dental hygienist, and your first patient asks you,
"So how long have you been working here?"
This is one of the frequent awkward situations for a new dental hygienist. It's easy to get discouraged when you're a new grad, especially if you allow awkward patient interactions like this to shrink your confidence. So for this video, we will talk about some tips and tricks to boost your confidence as a new hygienist. First of all, just remember, you've completed your dental hygiene program. You've taken your board exams, and now you are a licensed dental hygienist. You are ready, so stop referring to yourself as the new girl or the new guy, and use these following tips to establish yourself as the upbeat, fearless hygienist you are. Number 1, plan everything ahead. Small things like having all the XCP radiograph rings ready for your FMX before you even bring the patient back into your room can be the start of a smooth, stress-free appointment. It's never a good look if your nervousness is showing as you struggle to find the correct way to stick the XCP tab to the sensor, all while trying to still focus on small talk. So make sure you plan ahead. Number 2, collect everything you need before each appointment. I know we just talked about the x-rays like a physical thing you could do, but something that's more of a mental thing you could do is check which patients are due for bite wings, which patients are due for an FMX, which ones do you need to perio chart, which one's this and that, who needs fluoride. So write that, like write little notes on your chart if you have a paper chart, or if you can write in the little notes section on the digital chart. It's usually helpful to me. I still do it. Like I'll go through my whole day and just write who needs what for the whole day, then I just know. You don't have to check before every patient, it's already on there. Number 3, listen to your colleagues. If the other hygienists you are working with are good, experienced role models, ask for their advice and listen to how they phrase certain things to patients. That's what I did. I was hearing how smoothly the conversations were flowing in the other rooms, you know, about, oh, you needed SRP, and I would listen to how the other hygienist would say it, and it was very smooth. So I took certain words and expressions that I would hear, and it would allow my conversations to go just as smoothly. I've absorbed so many tips by simply like overhearing either the dentist or another hygienist in the other room having positive conversations. Number 4, communicate to the patient. Now use everything you know, whether it's something you overheard in another room and you love how they phrase it, or your own way of phrasing it. Whatever the case, communication is key. Even though you're on a tight schedule, you're stressed, you're trying to focus on your scaling technique, you can't forget to talk to your patient. Silence is sometimes not the answer when you're nervous. Of course, everyone is different, but for me, I feel like once I talk it through, I'm like so confident again. Calmly explaining the procedure to the patient while you're doing it, telling them what you're doing, can not only calm them down, but boost your own confidence as well. Because you're feeling them calming down, so you're calming down too. Does that make sense? I just feel like good communication often validates your level of experience to the patient. Number 5, if you're still not feeling confident, another great tip is to take an improv class. Improv classes are not only for aspiring comedians. In fact, most beginner improv courses are taken by the general public for personal reasons. Improv classes, the basis of them, they teach you how to turn your stress and the butterflies in your stomach into fuel for your performance, which is useful for public speaking, social anxiety in general, and of course, your job, your career, working in the dental office as a hygienist. If you could treat each appointment as a performance, focusing on the process, not the outcome, you'll be golden. Because when you visualize that you're awesome, you'll be more capable of presenting yourself as awesome. So using these 5 tips, when the patient asks you on your first day,
"How long have you been working here?"
sometimes one of the best, most honest and confident answers is, I've actually been only working here for a short while at this office, but I've been in the dental field for 3 years now. I've only been at this office for a short while, but I've been in the dental field for X amount of years. Maybe you were a dental assistant before dental hygiene school. Tell them how many years. Or maybe your only experience is from dental hygiene school, seeing patients in clinic. That's fine, tell them how many years. It's not like you've never seen a patient before. Just remember, you have all the experience you need to succeed. You've passed all your exams, you've filled all your quotas. Now it's time to show off your skills by having confidence during each appointment. I really hope this video helps someone, so please like and subscribe and share with your friends, and I'll see you all next Tuesday for Teeth Talk Tuesday. Peace, love, and teeth.